AIDS continue to be one of the world's largest health challenges. An estimated 37 million people living with the disease globally last year. According to UN AIDS, we as South Africa had 7.1 million people living with HIV, so a large chunk of the global population living with HIV. But this country having the largest HIV treatment program globally. Now we know that 4.2 million people are accessing treatment. But why are we lagging behind on prevention? Now, joining us from our Sea Point studio is Executive Director of the South African National AIDS Council, Dr. Neveline Slingers, and in Pretoria, the Director of AIDS and TB Research at the Medcal Reseach Council, Dr. Abdullah. Let me start with you, Dr. Slingers. We have such a fraught history with HIV and AIDS in this country, and then a lot of talk of success. But now we're reporting that new infections among young people going up. What does that mean? Are we going backwards?
Well, in South Africa, we know that we have many successes, but we say we are now at a turning point. So the South African National AIDS Council has developed the new National Strategic Plan for HIV, TB and STIs, and that is the country's 5-year strategy to deal decisively with HIV, TB and STIs as epidemics. So we are aware that a large proportion of the new HIV infections are amongst young women and girls, and those are in between the ages of 15 and 24. And a key part of this new strategic plan, the plan that we're mobilizing people to implement and to work together to implement, a key part of it deals with prevention, because previously we were focusing a lot on treatment. We continue to focus on treatment, but we've also realized that we need to do a better job of prevention. So we've got we have many evidence-based interventions that we can apply for prevention, but the new strategic plan is talking about how to focus it and where to focus. So our aim is to use evidence-based interventions, but to focus it in terms of areas where you find people with the highest risk, and also in geographical areas where you find people with the highest number of infections.
Okay, so targeted. Dr. Abdullah, what do you think? Cyril Ramaphosa today was talking about a prevention revolution. Is that possible?
Oh, it's certainly possible, and it's also the kind of attitude we need. So the idea of the prevention revolution, is the right way to position this problem. We need drastic steps. We need major programs. In addition to that, we also need new tools to do prevention. And this is where our scientists in South Africa are actively engaged with developing new tools for prevention. There's certainly something that we need to focus on, and I would agree with that entirely.
Dr. Slingers, you were talking about women or girls between 15 and 24. Is this a psychological problem, a social problem? Why are they particularly vulnerable, and how do you target them specifically if you're going to deal with prevention?
Okay. Well, the Dr. Karesha, Professor Abdul Karim has done lots of work which explains why the women in this age group are at risk. It is basically about the fact that they are engaging in sexual relationships with people 7 to 8 years older than them, and they are becoming infected through these relationships because they're not using condoms. And then they go on later to infect their partners when they get married. So there's quite a lot of work being done on why and what are the drivers of the situation. I think another key part of the National Strategic Plan is about talking about providing targeted, customized services. And a key strategy for South Africa is the She Conquers campaign, which focuses on a holistic, comprehensive approach to prevention and service provision for young women and girls. So, for example, it looks at keeping girls in school, It looks at decreasing teenage pregnancies. It looks at dealing with gender-based violence, providing economic opportunities, because a lot of women say that because they're not able to find jobs, they're not able to enter into further education, this puts them at risk, and this sometimes forces them to have relationships with men who work and who can support them and provide them with funds for various things that they need, and they find that they don't have that much choice. Also, we find that women are not necessarily able to negotiate safe sex. Hence, there's also been a focus recently on prevention, things that women can use, things that they can choose. So as I said, South Africa has a comprehensive response called She Conquers, and that is being tried, and we are trying to expand that and implement it in as many places as we can in the country. And government departments, civil society, private sector, everybody needs to work together to make sure that these can be implemented.
All right, so the whole blessing issue coming up again. Dr. Abdullah, if we move away from prevention, where arguably we're doing very badly with more new infections, how would you rate South Africa right now in terms of our response, in terms of treatment for HIV and AIDS?
So we have a dichotomous response in that we're doing really well with treatment. As you've noted in your report before, there are now 4.2 million people on treatment in South Africa. That makes us the largest treatment program in the world at a very reasonable cost. So on that front, we're doing extremely well. But as you've pointed out, our real problem is that we're also the country with the largest number of new infections, and it's about changing the focus to prevention. When it comes to treatment, although we have a large number of people on treatment, and the result is that we have a huge increase in life expectancy, we still have 100,000 deaths from HIV. So the work is not yet completed on that front too. We need to improve our health systems, we need to improve our laboratory capacity, and we need to put even more people on treatment. So although we're doing well, we're not really at the end of the road yet, and we need to do a lot more work. We also need to do a lot more work in respect of improving the safety profile of our drugs. And the announcement today by the Deputy President that South Africa will be going to a new dolutegravir based regimen is a much better treatment option for our patients who are on treatment. So a good progress on that front. But the health system does need to be addressed. The weaknesses in the health system when it comes to staffing, when it comes to drug stockouts, when it comes to the skill of the clinicians to pick up problems, because as I said before, there are still too many people dying from HIV. Many of these patients with HIV are actually dying from tuberculosis, which, is a disease that we can diagnose and treat, and it does point to weaknesses in our health system that need to be addressed. So we're halfway there, but we still have a long way to travel.
Explain those weaknesses, Dr. Abdullah. We heard our own health minister talking about people going to clinics and not getting ARVs, getting something else. So is that the kind of training and things that you're talking about?
Well, it won't come as a surprise that when you have a program with more than 4 million people on treatment, it's going to come with these logistical problems. But those do need to be addressed. We need to put probably another 2.5 million patients on treatment, and it does mean that we need to concentrate on our clinics and our hospitals to make sure that they work efficiently, that they manage properly, that they're able to have the nurses and the doctors that they need, and to address kind of the drug stockouts, which we know we have repeated complaints about in many parts of the country. Those do mean more investments, better management, better leadership, and those things have to be addressed. Otherwise, we'll be stuck at where we are now. And you know, the bad sign is that there are still too many deaths from HIV in a country which really should be on top of it now.
Dr. Slingers, do you agree? Are you also heartened by that announcement that there will be a new treatment combination from April next year? It does sound like the drugs are getting better and better and cheaper and cheaper.
Oh, absolutely. We're very heartened to hear that, because not only is it a better drug with fewer side effects, it is also cheaper. And also we believe that people will be able to take the drugs a lot easier and maintain their adherence to the drugs if we have optimal drug combinations. I think we know quite a lot about the fact that people want to have drugs with fewer side effects. We know that as part of treatment, we don't only want people to start on treatment. It is very important that people remain adherent to their treatment and that they have a suppressed viral load, because that's also key to prevention, because it has been shown that when you have a suppressed viral load, you are less infective to partners that you have. So that's a key part of prevention, and hence the focus on adherence. I think the other options that we have to add to how we do adherence is also we have to understand why people struggle to be adherent to their medication. It's not only the drugs, it is also the support that they require. And we really need to, as I said, we're talking about customized, targeted services. We really need to understand and deal with the issues that are preventing people from remaining adherent to their medication. So certainly we welcome the new drug, and that is a key step. But there is also a lot more that we need to do. And as Dr. Abdullah said, we need the health systems to be strengthened, but we also need community systems to be strengthened, because people in communities need to know about the new drug. They need to know that it is a better drug. People need to come forward. People need to know that they will be supported while they're on treatment. So those partnerships and seamless movement of people from communities into the health facilities and then being supported in their communities is another element. But we welcome the new drug. Thanks.
And Dr. Slingers, back to you, but keep it short if you can. How do we get the extra 2.5 million or 3 million people who are not on treatment on the drugs?
That is certainly going to be a big challenge, yes. I think if we focus and we work together, we need the necessary leadership and accountability. We need to realize that we need to shift our focus to find those people that have not tested, and then find ways of linking them to services and making sure that the services are there. So that when you link somebody to a service, they are actually assisted and they are supported to remain on treatment. But it will be a big challenge, and we'll need all stakeholders to work together.
Dr. Abdullah, let me pose the final part of this to you. We know that there has been incredible success with mother-to-child transmission, almost eradicated, and South African scientists have often been at the forefront of AIDS research. Is there anything exciting you right now in terms of research or what's out there being tested at the moment?
So there are lots of exciting things on this front. Just yesterday, the Medcal Research Council announced the testing of a new vaccine. So we have 2 HIV vaccines which are being trialed. You know, that's very exciting news. In addition to that, there are a number of new prevention interventions, testing the use of broadly neutralizing antibodies in patients. We have trials with long-term injectables. We have trials with vaginal rings which are used for prevention. We already have had huge success with pre-exposure prophylaxis, or what is known popularly as the prevention pill. So there are lots of exciting developments on the scientific front, and we need to invest in this. We need to support our scientists in South Africa to do more of this research, because it's only through both dealing with biomedical prevention interventions such as a vaccine, as well as changing behavior and addressing the social and structural issues that we will bring about this prevention revolution.
All right, thank you very much. That was Dr. Farid Abdullah, AIDS and TB Research at the Medcal Reseach Council from Pretoria, and from Cape Town, Dr. Neveline Slingers, the Executive Director of the South African National AIDS Council. So there you have it, a lot of exciting developments when it comes to HIV and AIDS, but also very sad stats this World AIDS Day, increasing amount of new infections, especially among young women, and of course millions still not accessing antiretroviral treatment in this country.